Hi, my name is Josh Orr, and today I'd like to talk to you a little about American football injuries. First, we're going to start with the factors of American football injuries. They come in two different forms. Poor weather conditions and age are two very big factors when regarding American football injuries. Weather conditions due to rain and snow causing a slippery surface, which can cause injuries much easier, as well as ages, which is 14 to 18, mostly high school kids. This is the majority of the American football players, and since their muscles are not fully developed, as well as the poor technique used during the play, injuries are more often. Next, we move to the three most common injuries in American football. They are the anterior cruciate ligament tear, otherwise known as the ACL tear, the hamstring tear, as well as an ankle sprain. For the anterior cruciate ligament tear, it occurs when the ligament is stretched too far. It is commonly known as a sprain, and it comes in three different grades, from least severe to most severe. Grade 1 being the least severe. This is when the ligament is stretched but is still able to keep the knee in place. This is the least severe it can be, and the recovery time is much less than the most severe, which would be a grade 3. Grade 2 tear is stretched and it becomes loose, although not torn. It is also known as partially sprained, partially torn. Grade 3 is the most common ACL tear. This is when the ligament is completely torn in two separate pieces, and the knee joint becomes completely unstable and will require surgery for complete rehabilitative. Next comes the mechanisms of injury. This is how the injuries are performed. The ACL tear results from different actions. Direct contact or collision, most common in American football tackling. Also, as well as stopping suddenly. Both of these cause the ACL to stretch too far and possibly tear, depending on how severe it becomes. And the main causes for the ACL tear is excessive force on that tendon, and this can be due to compression or excessive rotation. There are three different assessment tests that can be done to determine how severe the ACL injury is. They are the Lachman test, the anterior draw test, as well as the pivot shift test. As for treatment, it depends on the severity of the injury. Grade 1 will have less treatment than the grade 3. The lower grades, grade 1 and 2, only require rest and rehabilitation exercises. You will have to go to physical therapy and work on getting that muscle back, but there will not be any surgery required. As for a grade 3 tear, there will be surgery, and it's a very long recovery process. There are a few exercises you can do to help prevent and as well as rehabilitate that injury. For a preventative exercise, we have the single leg balance as well as a lunge. The single leg balance will be when the athlete stands on one leg trying to maintain that balance for approximately 15 to 30 seconds. You want to repeat this 8 to 10 times for 1 to 3 sets, and you want to do this around 2 to 3 times per week. But make sure you leave at least one day in between the exercises to fully recover that muscle so you're not straining it too much. Next are the lunges or the lunge step. This is a very common exercise. You want to do about 10 to 15 reps since there's no weight, you're just working on that ACL injury. You want to do 2 to 3 sets, 2 to 3 times per week, again leaving one day in between each time you do the exercise to make sure that injury is fully rested. For rehabilitative exercises, we have the isometric contraction of the quadricep. This is when the athlete will stand with a straight leg and just flex that quad, and it will give some tension on that ACL to make sure it gets back to where it's supposed to be. You want to hold that for about 10 seconds, do 10 reps, 1 to 3 sets, and do this 2 to 3 times per week. To increase the progression for this, you can hold that stretch for more than the 10-second mark. Next, we have the prone knee flexion. This will be when the athlete lies flat down on his stomach and flexes his knee to bring his leg up. That will work on extending that ACL tear and bringing that ACL ligament back to where it needs to be for strength-wise. You want to hold that for about 10 seconds, do 10 reps, 1 to 3 sets, 2 to 3 times per week. You may add a TheraBand to increase the resistance once you feel comfortable and strong enough. Next, we move to the hamstring strain. This is a tear to the posterior muscles of the thigh. It is also identified by 3 grades, just as the ACL tear. Grade 1 being a mild or pulled strain in the hamstring. grade 2 being a partial tear in the muscle, and a grade 3 being a complete tear in the muscle. The mechanism of injury for a hamstring strain is sudden explosive movements. Now this can happen by jumping or sprinting. That quick movement really just tears that hamstring if you're not fully stretched out or strong enough to deal with the movements you're doing, especially if you are fatigued. There are some tests to determine how severe that hamstring strain is. There are a strength test, a range of motion test, as well as palpation, each of these determining how severe the injury is. Obviously, the higher grades cannot deal with the strength or the range of motion, as well as the palpation. You can feel the muscle in the leg separated or torn, and you can determine if it is a severe hamstring strain or a minor hamstring strain. As for treatment, the lower grades only need to use rest and ice. A common acronym for this is RICE, which would be rest, ice, circulation, and elevation. And that just gets the muscle going and back to where it's supposed to be. Just stay off for a couple of days, maybe weeks, depending on how severe it is, and it should be back to normal. As for the higher grades, again, the grade 3 may require some surgery. Few exercises. Again, we have preventative and rehabilitative exercises. As for the preventative exercises, we're going to go back to the lunge, but this time we're going to add a twist to really get that hamstring muscle moving and stretching out. This will help with bringing your hamstring back to where it needs to be, as well as helping it able to stretch more so you can prevent that high explosive movements tearing that hamstring. We're going to do about 10 reps each side, 2 to 3 sets per leg, 2 to 3 times per week. Next would be a glute bridge. This is when the athlete will lay on his back with his knees bent, and he will push up on one leg to raise his butt off the ground. This would be 10 reps, 2 to 3 sets, and 3 to 4 times a week. You may add weight to the exercise if you think it's too easy, and to help you get that hamstring stronger. As for the rehabilitative exercises, the minor ones, you can do this almost immediately. As for the grade 3 severity ones, you might want to take a little time and rest it up after the surgery before you start any exercises to bring you back to the strength you were. The first one will be a hamstring wall stretch. Again, this is just trying to lengthen that hamstring muscle and make sure it's able to deal with those high explosive movements. You want to hold that hamstring stretch for about 30 seconds to 1 minute, depending on how bad it hurts and how far you can stretch it. You want to do this about 2 to 4 sets, 3 to 4 times a week, and you can increase the time of holding that if you feel comfortable. Next, we have the prone hamstring curl. This is similar to the knee flexion. The athlete will lay on his stomach with no weight added, and he will flex his knee, and that hamstring will contract. That will work on strengthening that hamstring. You will do this 8 to 12 times for 2 to 3 sets, again 2 to 3 times per week. And once you feel comfortable, you may add a TheraBand for increased resistance. Finally, we have the ankle sprain, which is an injury to the anterior or posterior talofibular ligament, or the posterior tibiofibular ligament, or the calcaneofibular ligament. As you can see, there are many areas that this can be injured in, so ankle sprains are a very common injury in any sport, but football is very common to happen. Just like the other two, there are 3 different grades, grade 1 being the least severe, grade 3 being the most severe, with grade 1 being a partial tear in the ligament, grade 2 being an incomplete tear of the ligament with function impairment, so it's not completely torn, but you cannot use your ankle to the fullest ability as a grade 1 or no injury at all, with a grade 3 being a complete tear and loss of integrity in the ligament. So the tear will be completely through the ligament, as well as loss of range of motion and strength in the ankle. The mechanism of injury for an ankle sprain is excessive pressure on any of the ligaments mentioned. This most commonly is injured by plantar flexion and inversion. So when the foot is in a vulnerable state with the increased force or pressure on that ligament, it is very likely to tear or injure that ligament in any way. To assess the injury, there are a couple tests you can do. The anterior draw test as well as the evergent stress test. These are to determine the severity of the injury as well as any surgical needs or what ligament is actually injured. Treatment, as mentioned before, RICE, which would be rest, ice, compression, and elevation. This is a very common rehabilitative process. The ice is used to reduce the swelling, and you may do exercises to keep that range of motion intact. You don't want to lose that at all. But do not use heat, as this will increase the injury and inflammation to the ligaments injured. Again, with the exercises, we have 2 prevention and 2 rehabilitative exercises. Ankle circles will be when the athlete may be sitting or laying down with his foot in the air, and all he wants to do is move that ankle in circles to keep that range of motion of what it was, so he doesn't get too much swelling in there and loss of range of motion. You want to do this about 15 to 30 seconds, 3 to 4 reps for 2 to 3 times per week. You may add a TheraBand for increased resistance to help strengthen that more. Calf raises are a very simple exercise. You want to do these about 10 to 12 reps, 2 to 3 sets, 2 to 3 times per week. The athlete will stand with his feet flat on the ground and raise his legs off it by pushing up on his toes. You may add weight to the exercise with a weighted vest or dumbbells or anything that you might want to use to increase that resistance to help strengthen the ankle to prevent any further injuries. Next, we have the rehabilitative exercises. We have a toe curl, which will be when the athlete places a towel on the ground and curls his toes to bring that towel in. It's a very simple exercise with no weight. This is, again, after the ankle is already injured. You don't want to stress it too much or you may re-injure it. You want to do 8 to 10 reps for 2 to 3 sets, 2 to 3 times per week. And you may add more towels or a TheraBand if you can find a way to use one to increase the resistance and weight that you are pulling with your toes. Next, we have ankle eversion. This is when the athlete will work on his range of motion by pushing his ankle out away from his body, and you can also do inversion by bringing it in towards your body. You may hold this for about 6 seconds, do 8 to 12 reps for 2 to 3 sets, and you may use a TheraBand to increase resistance and add a little more weight on there to help you get back to strength. Thank you for your time. These are some references, and thank you again for listening to me talk about some American football injuries. Thank you very much.